Good afternoon. I'm Dr. Bivens from Optimal Plastic Surgery. Today we're going to talk about liposuction. Liposuction is the removal of fat from beneath the skin by utilizing a suction device which applies negative pressure through a small tube or cannula that will then remove the fat from beneath the skin. Everybody's an ideal candidate for liposuction. The issue is whether or not an individual understands exactly what their goals are and what the options that are available for them in order to achieve their goals. The American Society of Plastic Surgery and most of the medical boards from various states recommend no more than 5,000 cc's of fat that should be removed from each individual surgical session. That's so that the patient remains safe and we're not hospitalizing patients in order to replenish the amount of fluid or blood that is lost. That's very simple because there's two different ways to perform liposuction. It can be done either awake with some oral sedation or even intravenous sedation, or it can be done with the patient going to sleep. Should the patient desire going to sleep, then it's recommended not to eat or drink anything after 12 midnight the night before the surgery, particularly if the operation is going to begin at about 8 o'clock in the morning. The only scarring that one will see are actually the access points. Most surgeons will place the access point in creases, or they'll place them in places that are less visible or less noticeable because they'll be under the underwear or bikini or shorts or even behind the bra. So there's minimal external scarring. But of course, the lipo cannula itself does leave scarring under the skin because it is an invasive procedure. Following liposuction, one can expect to see a significant reduction in the amount of protuberant fat under the skin. Whether or not that constitutes a flat stomach is really dependent upon the individual's quality of skin. There are other things that cause the stomach to protrude. Sometimes the underlying muscles are very, very prominent, especially in women after childbirth. So there may not be a 100% flatness of the abdomen, but over time it should significantly improve once the swelling goes away. One has to understand that it's very difficult to create the absolute perfect result with one session. There are many instances where I tell patients this is probably a 3 or 4 session process. The first session is going to be debulking, and once you start to debulk, you can actually start to get a sense of what the refined areas are. Once the tissues settle after about 3 to 4 months, you can then do another session which now helps to refine. And then if there's something that remains that the individual is not pleased with or feels that it can be improved, it is not uncommon to really have a third session in order to achieve that goal. I think it's disingenuous and unrealistic to think that after one session, an individual is going to have the end result that they are absolutely 100% happy with. It takes about 6 months before you can truly appreciate the surgical results from liposuction. One has to really take into consideration and understand the inflammatory process and the wound healing process. This is not a static phenomenon. It's very dynamic, and it's very important to maintain good behavior after the liposuction. I want to thank everybody for spending the time, letting me bend your ear, listening and seeing what we were discussing. If you have any other questions,